Alright, so we last left off at the skull. We were about to go into it. So we're going to start off with the image of the skull, make it a little easier for us to go through the process of locating the individual portions. And we can try to make this quick. Alright, so let's get back to the skull and let's look at the image here. Alright, so the general skull. We already talked about the bigger sections in terms of uh, the bigger bones, the flat bones. We talked about the frontal bone, right? We talked about the parietal on the sides, the frontal, obviously the forehead, the parietal at the top and also sides. We talked about the occipital, which is at the very back and the base, and we talked about the temporal, which will be found on the sides. So now we're going to go a little bit into the more portions of it. One item that I mentioned that we didn't talk about last was the coronal sutures. All right, so as you can see here, there is a separation between the individual skulls. Right. Generally, if you were to think of your skull before ever seeing an image of it, you would think it was one whole item, but it is not. It is a bunch of pieces of bones, flat bones put together. All right, so starting from here, as you can see, there's a coronal skull suture, and you may remember coronal when we talked about the planes, right? When we said that it was a coronal division, that means we were dividing the body into a front and a back, or a dorsal and a ventral. Right. So here the idea is still the same, right? So as you can see, the coronal suture is separating the frontal from the parietal, right? Here we have the squamosal suture, right? As you can see, that's separating the parietal from the temporal bone, right? And at the very back, we have the lambdoid suture, right? Which is separating the parietal from the occipital, right? At the very base here, right past the process, right, you can see that we have the external auditory meatus, and we just covered meatus a few think in the last item, right? So meatus is just an opening, right? Now here we have our mandible, the lower jaw. Now you notice that the lower jaw has a major connection here, all right? So this would be the temporal mandibular joint, right? The TMJ, all right? Getting a little bit closer here, we have the coronal process. Okay. Now, we already mentioned the lower jaw. The upper jaw is the maxilla. As you can see, it's holding up the top of the tooth. Here we have the nasal bone itself, and we have the nasal septum, right, which we're not seeing. But if you have two of the nasal bones, right, the septum will be the very division of that. And I'll see if I can get an image that better suits that. Alright, so again, up closer to the back to the top here, we have here the orbital cavity. Obviously, that's where your eyes will be housed, right? So what I'm going to do is I'm going to see if I can get an image so that we can have an image of uh, the inside, so we can look inside of it. All right, now this is not an image of that I want to show you yet, but I wanted to just kind of show to you, so just to go back to the idea of the skull itself being separated. All right, so this gives you a very good image of what the separations are. All right, so as you can see here, you see how the parietal, both the left and the right, are both separated from the frontal. All right, and both can be lifted up. And at the bottom here, at the base, we have the occipital, and on the sides, we have the temporal bone. Obviously, this will be the left side of it, and that will be on the right side of it. And we have both sides of the zygomatic, the cheekbones, and then we have the maxilla, the upper jaw, and the mandible, the lower jaw. And as we mentioned before, here will be the temporal mandibular joint. All right, so that was just to kind of get back to what I was mentioning before. All right, so now this image here gives us a better picture also of the other bones that we didn't mention. All right, so we're familiar with the frontal, parietal, occipital, once again temporal, mandibular, maxilla, and the nasal bones. Two other items, and of course zygomatic. Two other items that we haven't talked about really are some smaller bones on the inside, ethmoid and the sphenoid. All right, two of my favorite bones, so we're gonna go over those as well. All right, so now when I say that these are two of my favorites, is because of how they actually look and where they're located. All right, so this is the sphenoid point. All right, so this is essentially located right about the middle part of the skull. Right, essentially what it does is it forms a great wedge between all the other bones, and pretty much brings them together. Right, now, if you look at it, this looks kind of like a bat. Right, so this is always one of the easiest item to remember. Right, has the greater wing, the lesser wing, has the slit. Right, we talked about. So this is one of the easiest ones to remember. Now, we're not going to go over the things like the optical foramen or the supraorbital features, foramen rotunda, ovale, and so on and so forth, because I think that's a bit more A&P. So this is more medical terminology. So I'm gonna stick to just talking about the general features of the actual uh, item itself and what it does. All right. So let's see if I can also get you an image of the ethmoid bone so that we can keep going. All right. So what you're looking at here is an image of the ethmoid bone. And essentially the ethmoid is it kind of makes out the bone around. If you take a look at it, makes out the bone around the orbital, right, the nasal, right, and things like that, and the eyes really, orbit and the eyes. We won't get into crystal galley and any of those things because I believe that's a bit more A&P more so than medical terminology. All right, so back to where we were. So we already talked about the major sections of the skull. Um, some little things to know about things like, let's say, the maxilla. Um, maxilla, right? The maxilla, the upper jaw. Essentially, what it does is fused by the midline, forms the upper jaw and uh, hard palate, right? Which is essentially the roof of the mouth. Hey, what am I doing there? Right, essentially the roof of the mouth. All right. Um, and if you ever heard of a congenital disorder called cleft palate, then you may have you may know what I'm referring to. All right. We already mentioned the nasal bones, so nothing to go into the nasal bone. We didn't talk about the lacrimal bones, but essentially the lacrimal bones are at the corner of the eye, um, and this is where you find the connection of the lacrimal sac coming out. All right. I don't believe I mentioned the vomer, which is the separation of the two nostrils. Right, I think I may have mentioned the bottom of it when I was talking about the nasal septum, but I didn't talk about the actual separation, which is the former. All right. We already mentioned the zygomatic, the cheekbones. Now, I don't believe we've gone over the sinuses yet. All right, so let me get you an image of the paranasal sinuses. Okay, so this is a nice and simple image of the paranasal sinuses. All right, so at the very top, all right, you have the frontal sinus, which obviously you can see where the name is coming from. Is it right above right below the frontal bone, and right above the nasal bone itself. Excuse me. Going backwards a little bit at the furthest back, we have the sphenoid sinus. Right, so you can also see like the general location of the individual bones also. Alright, at the very bottom, maxillary because remember, upper jaw was the maxilla. And then here we have the ethmoid sinuses. Alright, so again, just gives you a really general, good view of where the sinuses are located, and that's all you really will ever have to know about the location. Alright, or any image that's given to you, you can always just simply tell just by looking at it. So if you look at it from the side, alright, you can see that this will be on the top, by the middle, this is furthest back, and this is somewhere in the middle location. If you're looking at the image from this view, then again, frontal sinus at the very top, ethmoid here, and it will be a little bit harder for you to see. But if you can tell, if you ever felt right above your nose or just a little bit below, when you're sick, you'll be able to, or even right between your eye, your two eyes, right? You'll be able to kind of feel when it gets tender, a little tender, and a little pain when you have some sort of headache or excuse me, if you have some sort of nasal congestion or something in that nature. All right, so that should be able to, that covers that. We already covered the thorax region, so there's nothing else to cover on that. For the vertebrae, I didn't go in depth with the vertebrae, so let me see if I can get you the image that we worked with earlier for the vertebrae. All right, let's go back here. I believe we saw it right over here, and Google will find it for us again. Skeletal system. And I think this is the image that we use, so we might as well continue using it. Alright, so looking at the skeletal, the vertebrae, we didn't talk about it before. So from the very top, alright, from the axis going down here all the way to the very bottom. Alright, so at the very top, you have your first 7 sets. Alright, your first 7 set correspond to your neck, obviously, so that would be called a cervical vertebrae. Because remember, cervix, as we talked about earlier, is for the neck. All right. So the next 12, the next 12 would be corresponding to a thoracic cavity. So that would be a thoracic vertebrae. At the bottom here, remember that when we talked about the body parts, we said that the lower sides here were your lumbar. So that means the last 5 here are your lumbar vertebrae. And at the very bottom, where you see this big thick um, bones that are fused together, the vertebrae fused together here. All right, that would be your sacral, and at the very bottom of it, the coccyx. All right, now the sacral, for a better part, is divided until it fuses together eventually after after birth. All right, so that should be able to cover the vertebral column, and that should be it for us. All right.